So after a bit of a hiatus, we are back with Together We Can. I'm your host, Kevin Bargender, and today I'm joined by Rita Skroch of the ADRSC. And as the Elder Benefits Specialist, kind of go in a little bit more in depth on what you really do on a day-to-day basis.
I meet with people over the age of 60, help them fill out paperwork. Sometimes they'll come in, they are struggling with paperwork that needs to be filled out or struggling to apply for assistance. I can sit down with someone and complete a benefit check where we can look at what benefits are out there and if they would be eligible for them, and I can assist with the application process. I provide accurate and current information about different benefits. I help a lot of people map out their options regarding Medicare, the supplements, advantage plans, the coverage, the costs, the benefits, eligibility. And sometimes people have problems with landlord issues or other issues in life, and I can help them map out what legal action or other possible solutions would arise. Programs I can help with would be Medicaid, Medicare, Part D, your prescription drug cost, and senior care, Badger Care for medical coverage, Extra Help, and that's a program that helps people with their prescription drug costs through the federal government. I can help people sort through Medicare supplemental insurance, Medicare Advantage plans, just medical bills in general, food share, Social Security disability, Social Security retirement, SSI, and even some housing and utility issues.
And what happens if someone's under the age of 60 and they still are interested in some of these benefits?
If they call and they get Sammy at the front desk or me or any one of us, Shelley is our person that they would talk to for any of those things for ages 18 to 59. If they're over 60, I would help, and sometimes we fill in for each other. So, yeah, they should not be afraid to call and ask. Shelley is also our National Family Caregiver Support Program coordinator, and she does the Wisconsin Alzheimer's program. It's best to call and set up an appointment because any one of us can be with somebody, or we can be out on a home visit and not available to meet with you. So it's best to call that number, 715-538-2001, and just listen to the options and press whichever option will lead you to who you need. And if we don't answer, you get our voicemail, leave us a message, and we'll call you back as soon as we're able. Mine rings right at my desk, so if I'm with somebody, I'm helping them, and I don't answer the phone until later.
But I'd like to thank Rita from the ADRC for coming here, and we'll have a PowerPoint presentation narrated by Rita up for you next.
Hi, today I'd like to talk to you about maximizing your Medicare benefits. Your Medicare card should be a white card with a red and blue stripe. It should have a unique ID number, not your Social Security number. If you're using a card with your Social Security number on, you need to call the number on the back of the card and get a new card that just has your unique number on it with letters and numbers, not your Social Security Social Security number. I'd like to go over a little bit the different parts of Medicare. Part A. Part A, Medicare covers inpatient hospital care and skilled nursing home care. It provides limited coverage for hospice or home health care. And then there's Medicare Part B, which covers doctor's services, clinics, outpatient, and some preventative services. Some people have Part C. Part C is actually also known as the Medicare Advantage Plan. It's an alternative way to get your Medicare benefits managed by private insurance companies that are approved by Medicare. It combines your A and B, and sometimes it combines Part D drugs. And then there's also Part D, which covers your cost of prescription drugs, and that also runs under a private insurance company approved and under contract by Medicare. So we have this little map, and we got on the left side we got Part A hospital insurance, Part B, medical insurance, and then below that we have Medicare supplement, which is also known as a Medigap policy, and Part D coverage. That is one way to get your health care coverage once you are on Medicare. There is an option, and that's on the right-hand side, Medicare Advantage plans. It combines A and B and your D, your drug plan. So I guess we'd like to start with A. A covers cost of inpatient services. So you have to be inpatient hospital, skilled nursing home, home health benefits, hospice benefits. Medicare Part A is a part of Original Medicare. Normally, if you have enough work quarters, work credits to get a Social Security benefit, there is no premium for Part A. There is, however, a deductible. That deductible for 2022 is $1,556 per benefit period. So a benefit period is separated by at least 60 days. So a benefit period would be landing in the hospital, maybe going home and maybe being re-hospitalized. As long as there is not 60 days in between, you don't have to pay the deductible again. For 2023, that deductible is increasing to $1,600. Hospital observation status. Observation status is not an inpatient, and Part A will not pay anything on that. Your Part B is going to pay for your hospitalization status. It's going to pay for your doctor's services and the hospital outpatient services after you pay your deductibles and coinsurance. This is when you're in the hospital for more than a few hours. You want to ask the doctor or the hospital staff if you are an inpatient or an outpatient. Your hospital status is going to affect how much you pay for that service and whether Medicare will cover if you end up being transferred to a skilled nursing home from the hospital. So we're back to our map. That was A, the first block. Let's move on to Medicare Part B, the second block. Medicare Part B for 2022 will cost you $170.10. This is normally deducted from your Social Security check. 2023, that will decrease down to $164.90. Some people do have a premium that is higher than that amount if their income for a single person is over $91,000 or if it's over $182,000 for a couple. And Part B has an annual deductible of $233. That is also decreasing with the new year to $226. Part B covers 80% of your outpatient services after you pay the deductible. So outpatient services, that's your doctor, your clinic, your lab, your x-ray, your durable medical equipment, diabetic testing supplies, ambulance service, and preventative services such as your annual wellness exam. That leaves gaps. Medicare does not cover 100% of your Medicare bills. A covers 80% of your hospital, and B covers 80% of your outpatient, your doctor clinic. So you have a choice to make. You may choose to purchase a Medicare supplement if you have Original Medicare, or you may choose to go with and enroll in a Medicare Advantage plan, which is also called a Part C plan. So we're back to our map. A and B. Let's first talk about supplement down here in the lower left-hand corner. Supplements are private insurance policies to supplement Medicare. They're approved and regulated by the Wisconsin Office of the Commissioner of Insurance. You must have A and B in order to buy a Medigap policy. Your premium for this type of plan averages about $150 a month. It's a basic plan that pays the 20% that Medicare does not. So Medicare will pay its share of the approved amounts, 80%, and then this Medigap policy or Medicare supplement would pay the other 20%. And normally there is no reason to change these policies from year to year. Medigap policies in Wisconsin offer different riders. riders can be, they're going to cover that Part A deductible we just talked about, or the Part B deductible. It may cover co-pays. You can choose a rider that may cover some excess charges or additional home health care, or emergencies during foreign travel. So we're back to our little map, A and B and Medicare supplements. We're going to move on to talk about what if we don't go with a supplement. What if we go to the right-hand side and look at some Advantage plans or Part C plans? These plans replace your original Medicare. These are private insurance companies approved by Medicare. They are going to cover both your A and your B coverage. They normally offer a low premium or maybe no premium at all over top of what you're already paying for your Medicare Part B. In most plans, you may have to see plan doctors. So this may limit you to a network, and you would have to see a doctor within that network. You usually pay a copay for these covered services. So like if you're going in to see the doctor, it may cost you $10, $15, $20. If you're going to see a specialist, it may cost you $40. Different plans have different amounts of copays for different services. These plans might also offer you extra benefits. So we can look at some advantages and some disadvantages. The advantage would be low or no monthly premium. The disadvantage would be you'd have copays and out-of-pocket costs if you have a bad health year. An advantage would be coordinated health care within the network physicians, but the disadvantage may be that you would have to pay higher costs when you go out of network. Advantage, some offer some extra benefits such as vision, dental, hearing. The disadvantage is there are no state mandates that they have to provide certain services, and there are no protections. Advantages, there's a variety of plans and choices. The disadvantages, that can be sometimes overwhelming, all the different plans and all the different services that are covered. An advantage can be these plans change from year to year. The disadvantage will be maybe you have to keep up and look at what the plan is offering, and you may have to be changing from year to year to get the coverage you want. The advantage is you would know what your out-of-pocket maximum would be. So there is a limit, an annual, yearly out-of-pocket copay limit. Once you reach that copay limit, then all your copays would drop to zero for the remainder of the year. Another advantage would be that they must follow the CMS Medicare regulations. A disadvantage, enrollment is limited to specific times of year, and that would be right now during open enrollment. October 15th through December 7th of each year is open enrollment. It's important to review your plan every year to be sure that you have the appropriate coverage for the upcoming new year, and that your doctor is in network and you know what your copay limit would be. Many people receive mass mailings from these insurance companies, and this can be very confusing. But we need to keep in mind they cannot cold call you, so there's no unsolicited phone calls allowed. They can mail you stuff, and as soon as you call them to ask questions, that opens the door that it's all right for them to give you their full sales pitch. Agents may not come to your home uninvited. Plans may not ask for personal information over the phone or via email. If you know of a company that is doing any of these, you want to report that violation to 1-800-MEDICARE because they are not allowed to cold call you. All right, so we got our A and our B coverage. We got our supplement. We looked a little bit at Advantage plans and the pros and cons. Let's take a look at Part D coverage. So if you go with A and B and you go with a Medicare supplement, you're going to need a Part D drug plan. These are private drug plans that are approved by Medicare. Enrollment is voluntary, but there is a huge penalty. They call it a late enrollment penalty. They will charge you a 1% per month penalty for each month that you go without drug coverage. There is no penalty if you have previous creditable coverage. Creditable coverage would be maybe through the VA office, or maybe you have senior care through the state of Wisconsin. Then you would not be penalized. There are two ways to get Part D drug coverage. One way is to enroll into a prescription drug plan, a PDP. Like I said earlier, if you have a supplement, you would need a prescription drug plan. If you decided you were going to go with an Advantage plan and lock into a network and have a lower premium and have some co-pays, then you would want to lock into an Advantage plan that has prescription drug coverage. And that prescription drug coverage, you can't have a Part D plan in addition to an Advantage plan. So you couldn't choose a Humana Advantage plan and take a Cigna Part D plan. They don't work that way. You either have Medicare supplement with a drug plan, or you have an Advantage plan with drug coverage. If you go with an Advantage plan that does not offer drug coverage, then you would have to have creditable coverage through the VA office or through senior care through the state of Wisconsin. This screen maps out a little bit about how Part D works. So when you first start out the year with your Part D drug plan, some plans have a $505 deductible. Some plans have less than $500 deductible. Some plans only have a $100 deductible. Some plans have a $0 deductible. But once you are through that first $505 deductible phase, then you would pay a 25% copay for all the prescriptions that you have filled. And your plan, your Part D drug coverage plan, would pay the other 75%. Once you have reached total out-of-drug costs of $4,660, that's what's known as the coverage gap. It's also called the donut hole. Then you're going to pay 25% for all brand names and 25% for all generics. Once you get through that stage, then the last stage is called catastrophic coverage. This is where you begin, this is where you land once you have paid total out-of-pocket costs of $7,400 for drug costs. At that point, that's catastrophic coverage, and you would pay minimal costs such as $395 for generics and $985 for brand name prescriptions, and the insurance, the Part D plan, would pay the remainder. So, annual enrollment period, October 15th through December 7th. You want to look at Medicare Advantage plans and also Medicare Part D plans, because they can change their requirements, formularies, pharmacy networks, premiums each and every year. And you want to review your plan annually to make sure that you are enrolled in the next plan, the right plan for you for next year. How to choose a plan. You can go out to medicare.gov and look at the plan finder. You enter in your prescriptions, your choice of pharmacy, and it sorts through the 23 different drug plans out there and lines them up lowest costing to highest costing, and you can compare plans and see what meets your needs, which pharmacy would be in network, which is a preferred pharmacy. Or you can call Medicare at 1-800-633-4227. They will be able to help you. You can also call the Medigap hotline. That is 1-800-242-1060. This is the Medigap hotline. They would help you with finding Medicare supplements and the rules and the ins and outs of Medicare supplements. There is the Disability Drug Helpline. That's 1-800-926-4862. Or you can call the ADRC and ask for Rita, the Elder Benefit Specialist, if you're over age 60, or Shelley, the Disability Benefit Specialist, if you're 18 to 59, and we would be happy to help you pick a Part D plan or look at what your options are. And our number is 715-538-2001. And like I said, you'd have to listen to the options and pick the correct option for Rita, the Elder Benefit Specialist, or Shelley, the Disability Benefit Specialist. This is a little screenshot about the Medicare Plan Finder. Like I said, it's at medicare.gov. It's a government website. You would want to hit Find Plans, and it walks you through multiple steps to complete your search. You can do a personalized search where you would log in with an ID and a password. You would need an email address to do that. And the search will pull the data, including your prescription drug information and your My Medicare account from the past year, so you would have all those drugs to enter. I do not do that. I do an anonymous search where I enter your information, zip code, so that we narrow it down to which county you're in. Enter your prescription, your medications, your prescriptions, the name of the drug, how many milligrams, how many times a day you take it, whether you fill it every 30 days or every 90 days, and then your pharmacy preference. So we can enter a couple different pharmacies so we can compare local pharmacies to the box stores, Walmart, Walgreens, CVS, and we can pick the right plan. Eligibility for assistance, we would ask income and asset questions. If you're not eligible for the extra help, we can still proceed. And then we can also choose, as a pharmacy preference, we can choose retail mail order. So you can choose whether you want to receive it by mail or whether you want to pick it up at the pharmacy. And this is a little screenshot here. WellCare Value Script tells you your total monthly premium is $14.80. It's a PDP, so it's prescription drug coverage only. So you're going to pay $14.80 a month. The total cost for the year is $177.60. That is your premium and your copay at the pharmacy. And then it tells you what the deductible is. Some plans will not make you meet that deductible if you're just taking generics. But it's good to keep that deductible in mind, because we're looking at Plan Finder based on what prescriptions you're taking right now. And things can change for the new year. But what you're taking right now is our best estimate. And that's what we want to use. Some additional considerations are your medical providers or your pharmacies in network. You want to make sure your plan covers your pharmacy. If you're choosing an Advantage plan that covers medical and drug coverage, you want to make sure the doctor, clinic, hospital that you want to go to is in network. And what the co-pays are going to be for your services. So if we compared different plans, this plan here is $15.60 a month. That is drug coverage only. The total for the year, the deductible, if you decide you wanted to enroll in that plan, we could hit the enroll button and enroll you right there on the screen. It would ask for your Medicare number, your name, your address, your birth date, a few questions in addition to that. When we do these Plan Finder comparisons, the phone number also is printed at the top for WellCare Value Script, so you could call them directly and enroll over the phone. So if you had questions about the Plan Finder comparison, you could also ask. What if somebody needs help paying for their Medicare costs? There are two different places to get help with your Medicare costs. One is a Medicare savings plan. It looks at your income and your assets, and if you're eligible, it helps you pay that Medicare Part B premium. Earlier I said for the current year it's $170.10, and for the new year it's $164.90. But if you're eligible for that Medicare savings plan, Based on your income and your assets, we can help you fill out an application and you can apply, and that would help you with your Medicare costs. Very painless. There is also the extra help through the federal government. That is an online application, or you can call Social Security directly. That's also based on your income and your assets. Asking for extra help or having trouble with your Medicare costs, there is the Senior Care Drug Plan. This is through the state of Wisconsin. It's based solely on your income. It works in two different ways. Some people have come in and have a Part D plan and a supplement, but they've been prescribed a new medication and it's very costly. They're in the donut hole and their costs are expensive. We can do an application for senior care. It is prescription drugs, self-administered prescription drugs for residents age 65 and older, the state of Wisconsin. It's $30 an annual fee. There is no asset limit. It's just based on your income, but it is considered creditable coverage. The level of assistance depends on the level of your income. So the higher your income, the higher the deductible. But like I said, it works in two different ways. You can use it in addition to your Part D plan to help you get through that donut hole, or you can use it as standalone coverage because it is creditable coverage. So if you were to choose a supplement, but you didn't take many prescriptions, you could choose senior care as your creditable coverage in addition to that.
So if people have questions about the information that is presented today, how can they reach out to you?
Any one of us would be happy to help at the ADRC. Just give us a call Monday through Friday, 8 to 4:30. Our number is 715-538-2001, and there's a menu of options, who to pick. If you don't know, just pick one and somebody will assist you, or you'll get in a voicemail to leave a message. There are 13 of us there, and we have some amazing volunteers that help with the food and home delivered meal and food, nutrition, and transportation programs. So just give us a call.
Well, thank you for everything you do for the community, Rita. And
thank you.
We really appreciate it. And thank all of our viewers for watching another episode of Together We Can. Join us next time, and we'll have a new guest on Together We Can.